There are 85 new cases of COVID-19 in New Zealand over the last 24 hours. This comprises 76 new confirmed cases and 9 probable cases. There are 37 individuals that we can confirm have recovered from COVID-19 infection. Currently, there are 8 people in hospital with COVID-19. 3 are in Wellington Regional Hospital, 2 in Nelson Hospital, and 1 each in Waikato, Auckland and Whangarei hospitals. 6 are stable, and 2 patients are in a less stable condition, one of whom is in intensive care. Our laboratories continue to work apace to process and report test results as quickly as possible. And over the last 7 days, we have processed an average of 1,479 tests each day around the country. A reminder, anyone who has been tested and is awaiting their result should be in strict self-isolation until that result is confirmed. Of course, contact tracing continues for all those confirmed cases, and in addition to having additional staff in the public health units supporting that, we have our national operation at the Ministry of Health staffed by a range of health professionals that is increasing each day. We are still seeing a very strong link to overseas travel as well as to confirmed cases, so close contacts of confirmed cases. And there is a small number of clusters we continue to investigate. Those ones are on our website, no additional clusters from those we reported yesterday. So in summary, the combined total of probable and confirmed cases in New Zealand today is 368. Personal protective equipment. There's a lot of ongoing interest in not just our supplies, but the supply chain for PPE. We are just finalising and circulating updated advice to health professionals on the appropriate use of PPE when they do and when they don't need to use it to keep themselves safe. This will be on our website later today and circulated around to the range of workforces that need that advice. That advice, or similar advice, will also be provided for essential workers who may have contact with people in their day-to-day work and just what sort of precautions they need to take, both the use of masks potentially and of course hand hygiene measures. As I've said over the last few weeks, we have a national pandemic supply of PPE, and individual DHBs also have their own dedicated supplies. In the Ministry of Health National Reserve and in stores that are held in reserve in district health boards, we currently have 1.9 million aprons and gowns, 2.7 million pairs of gloves, and 60,000 sets of eye protection. And that is in addition to the 18 million masks that continue to be in our national store, half of which are regular surgical masks and half of which are N95 masks. On top of that, there's another 5 million or so out in district health boards. The Ministry is currently exploring all existing and a range of new avenues to ensure that we maintain our stock, and we have a range of very productive conversations happening, and that includes working with senior private sector people across New Zealand who have very good networks internationally. All stones are being turned over to make sure we keep our stocks at the levels that will be needed to protect our healthcare workforce and essential workers. 3 days ago, on the 24th of March, the Prime Minister, with the agreement of the Minister of Health, issued an epidemic notice under the Epidemic Preparedness Act 2006. Now, that notice unlocks the use of special powers by medical officers of health under the Health Act 1956 to prevent the outbreak and spread of COVID-19. That's the legal underpinning for the lockdown. And in addition to that, I've issued a national notice to activate Section 70 of the Health Act 1956. And since Wednesday night, that has prohibited large gatherings, and required premises to be closed, with the exception, of course, of our essential businesses. There is more information on this on the Ministry's website, and more special powers may be used as the situation progresses, and the page on our website will be updated when they are. As you may know, we've put out a call to retired or currently non-practicing health professionals to support the COVID-19 response should they be required. And there's been a fantastic response there. More than 2,500 have registered already, and that number continues to grow. So as well as retired workers, we've had interest from people who are not currently working in clinical roles. For example, they are on maternity leave, and they are keen to help with the response as well. From today, healthcare workers will be able to register their availability on the Ministry of Health website, and we can then match them to roles that need to be filled in the sector. At the moment, that is particularly assisting with non-patient contact roles like Healthline and our contact tracing service. So in summary, these are unprecedented times for New Zealand and indeed internationally. We are all in this together. As I've said over the last few days, we do expect the daily number of cases to grow. We are testing to find those cases and to take appropriate measures. It will take between a week and probably 10 days before we start to see that number turn around. It will turn around if we keep doing our bit. Modelling shows, and there is a range of modelling out there already in the public arena, that the higher the level of compliance with the measures in place under Alert Level 4, the greater its impact will be on reducing our number of COVID-19 cases, and therefore the impact that will have in terms of hospitalisations and deaths. So I encourage New Zealanders as we go into the weekend may not feel any different from the week, given that most people are at home, but do continue to look after yourselves and your families. Do get some fresh air if you can, and be physically active in your bubble. Look after yourselves, your loved ones and your community. I'll hand over to Sarah Stewart-Black to make some comments now.
Thank you. I'd like to start with thanking everybody for staying home. Staying home, as you've heard, saves lives, and we must continue to do this. We have information from the police that generally people are doing the right thing. But we need for everyone to be thinking and acting more carefully about how they can stay at home to make a difference and save lives. There were some isolated incidents where there were reports of people congregating, and in these situations, those people were spoken to and provided with some advice about what the restrictions mean. The government is under no illusions that these Level 4 restrictions, while necessary, have a very real impact on people. These restrictions are dramatic, and a sudden shift in how we live, work and interact with each other. If you're struggling, you're not alone. We're working across government and with partner organisations to make sure that people get rapid access to what they need, help with finances, help with accommodation, access to healthcare and medicines, and connection to people in their communities. If you do need help, please reach out. We want to make sure that everyone has what they need to get through in the next few weeks. If you're concerned about someone, please check on them or reach out to government and community organisations who may be able to assist and advise. Please remember that even when we're at Alert Level 4, that the government and other agencies are still open and available to help you. Challenging as these Level 4 measures are, adherence to them is critical. The better we do this, the sooner we can emerge from it. We have a critical window to save lives and make a huge difference to New Zealand's future. As Dr. Ashley Bloomfield has noted, over the coming days we'll continue to see the numbers rise. Hang in there. We know that these measures are the best thing we can do to break the chain of infection. We understand it places strain on you and your families, and the sacrifices that you are making will save lives, and for that we are all deeply grateful. In regards to income support, we would like to reassure work and income clients that regular benefit payments and superannuation will continue as usual. Work and Income are delivering services over the phone and online to ensure clients and staff don't have to have face-to-face contact. While service centres are closed, staff are still working to help clients over the phone, and the government helpline number to call is 0800 779 997. Work and Income will continue delivering essential income support and housing services, the new wage and leave subsidies for employers, and helping other essential services like supermarkets find the workers that they need. In regards to accommodation, the temporary accommodation service, which is run by the Ministry of Business, Innovation and Employment, is up and running. The service is working with other government agencies to assist in providing temporary accommodation to those required to self-isolate who can't do so in their own homes, both New Zealand citizens and people visiting New Zealand. People that need to register with the temporary accommodation service can call 0508 754 163, where a member of our team will help them with registration. The line is open 24 hours a day. There is a cost for temporary accommodation, and the service will work with each individual about how to meet this cost. If you're a New Zealand citizen or resident on a low income or benefit, you can contact Work and Income to see if you're eligible for support. If you're a visitor to New Zealand and need assistance to meet the cost of temporary accommodation, we recommend you contact your embassy or consulate for further assistance and advice. Finally, we know that things are really tough right now, and for people especially who are living with mental illness. If you don't live with mental illness, you may still feel really stressed or anxious by COVID-19, and this is completely normal. Reach out to your other supports over the phone or online, family, whānau, friends and workmates. We also recommend sticking to a routine, such as having regular meal times, bedtimes and exercising. But if you feel you're not coping, it's important to talk with health professionals. For support with grief, anxiety, distress or mental well-being, you can call or text 1737 free, anytime, 24 hours a day, 7 days a week, to talk with a trained counsellor. Please don't hesitate. Thank you.